Hey guys, welcome back to Defeating Hair Loss. One of the questions that we're asked a lot is how many grafts, obviously. And if you go to different clinics, different places around the country, around the world, you're gonna get some different answers, which kind of makes no sense to me. I'm not saying that I'm always right, but I just want to show you how I talk to patients about the number of grafts potentially they will need in certain zones. Now, what we have behind here, please excuse the artwork, I'm trying to keep this as organic as possible. This is your top of your head looking down, obviously, your ears on each side. The frontal zone is the hairline, that's in the red. Behind that, in the green, the grid, is what I call kind of behind the hairline. Then in the middle, obviously, the mid-scalp. And then we go back to the crown, which is pretty obvious back there with the big bald spot. So when we talk about the hairline, that to me is the most important part because obviously that's what everybody sees. We're looking at a number of anywhere from 2,000 to 2,500 grafts. Now, again, this is all just generic. Not everybody's the same, and these numbers are gonna vary, but I'm pretty good at this, okay? So this red line coming across here, that hairline is 2,000 grafts or plus or minus a little depending on some things, placement of the hairline, unless you include the temporal peaks. The temporal peaks are on these corners here. We just shot a video with Bobby Dunlap on Dr. McGrath's website because he did his second procedure and they talked a lot about temporal peaks. Not a lot of doctors do temporal peaks. Dr. McGrath does. It's kind of cool because you can go lower in the frontal zone as long as you tie it in with the hairline. So it's all about the numbers. So if we include all the red here, which includes the temporal peaks, you know you're right at about 2,500 grafts. The rest of it gets a little interesting. Before I get into the number of grafts, what I have down here is what we like to use the meds for. Now keep in mind, the meds aren't gonna work that much for the hairline, but the meds are gonna work way better in the mid-scalp and crown, and even possibly behind the hairline if you have really strong hair. So that kind of skews it a little bit. That's why we like to kick the can down the road sometimes and get you on the meds for about 6 months prior to see if we can get a little bit of thickening or regrowth. But if we just go to the sheer numbers, now we're looking at, behind the hairline, let's just say 1,500 grafts, just to shore that area up. As we move back and go directly to the crown, crowns are hard. They're more difficult because it's a helicopter view. And we have to do it in a circular pattern, which doesn't allow, from an artistic standpoint, to make it look like there's more density. So we need a lot of grafts. So we need at least 2,500 in the crown. Just another reason why you would use the medicine to try to take that crown from this to this. It's just less surface area. And then those numbers are gonna vary in the mid-scalp as well. These two areas here from side to side are gonna vary from patient to patient. I call it like the NFL between the hash marks versus the college, or the opposite of that, whichever is bigger. If you have more space in between your ears or over your ears in hair loss, it's just more surface area. So that's where these numbers can go up. So I hope that helps. That gives you an idea of how many grafts you're probably looking at. Don't forget to like and subscribe. See you next time.